Do you get a bunch of junk mail every day? Now imagine losing your or your child's health insurance because you missed one of those envelopes, or the mail got lost, or you made a small mistake on the paperwork. That's what happens with Medicaid churn. I'm Dr. Nathan Chomolo, a pediatrician, internist, and Medicaid medical director, here to share why you should care about Medicaid churn and what we can do about it. Churn is when people fall off Medicaid, then re-enroll a few months later. Most of the time, it's not because they make too much money, it's because of things like missed deadlines, confusing forms, or outdated addresses. And churn doesn't just hurt families, it's expensive. A federal report found that churn can cost states up to $400 to $600 per person in extra paperwork and staff time. The health impacts are even worse. One study found that adults with diabetes who lost coverage, even briefly, ended up with more ER visits, more hospital stays, and hundreds of dollars in extra costs compared to those who stayed covered. Other studies have linked churn to delays in cancer treatment, missed medications, and worse prenatal care, putting moms and babies at risk. Now, Congress is considering a plan to make people prove they're eligible for Medicaid every 6 months. That would make things even worse. It ignores the reality that many families, especially Black, Indigenous, and Latino families, work jobs with changing hours and seasonal incomes. A short-term bump in income can make someone look ineligible even if they qualify over the full year. That's how families fall through the cracks. And it's not just bad for patients, it's inefficient. For the whole system, it means more phone calls, more mailings, more casework, and higher costs for states, health plans, and providers. But Minnesota, we've also seen what works. We've made progress by simplifying forms, doing culturally specific outreach, and expanding 12-month continuous coverage for kids age 6 to 21 and 72-month continuous coverage from birth to age 6. These changes have reduced churn and even eliminated racial disparities in who loses coverage. So why go backward? Tell Congress, say no to 6-month eligibility checks, support policies that help families stay covered consistently and fairly, because no one should lose their health care because of paperwork.